This is the last video for chapter 19. We are next talking about German measles, officially called rubella. It can be protected against by the MMR vaccine, measles, mumps, and rubella. This is a virus spread by respiratory droplets that can only infect humans. It's generally a very harmless infection that shows up as a mild rash in kids, like you see here. It's diagnostic for the disease, the rash, and you can confirm with serological testing, which by now you know is tests looking for antibody directed towards the pathogen. Despite the normally harmless symptomatic signs of this disease, it is very important to have a vaccine for this viral infection because if a pregnant woman gets infected with the virus, it will lead to birth defects and potentially death of the fetus. Hence, the main reason to have this vaccine is to create herd immunity and protect pregnant women from becoming infected with this virus, which can be devastating to the fetus. This graphic is showing the effect of the vaccine. The attenuated live vaccine was approved in the early 70s, and you can see that it pretty much bottomed out the infection. Now, instead of talking about tens of thousands of cases, we're talking about a handful of cases that might arise in any given year. This next infection is rubella, which is measles, and I need to contrast the seriousness of this disease with the mildness of rubella. Measles is a very infectious virus. It does have a mortality rate of 1 to 5% when infected. Like rubella, it's known to be spread by respiratory droplets, but it can also be aerosolized. It's also part of the MMR vaccine. While the infection is systemic, the diagnostic sign of the infection is the characteristic rash, which you can see in this image of an individual looking very sick and feverish. Along with that rash is something called Koplik spots. These are important. If you look inside this mouth, you will see as shown here the presence of little white areas surrounded by red rings. These are Koplik spots and are specific for this viral infection, for measles. One of the things about this virus is, once you're infected, you may have a complication called subacute sclerosing panencephalitis. It's listed here. Although very uncommon, it's a terrible effect of the virus that will affect your neurological capabilities and can be fatal. Another interesting fact that has been recently discovered about this virus is that it wipes out your memory response in your immune system during infection. What that means is that by the time you recover from measles infection, the virus wiped out your memory lymphocytes, leaving you susceptible to all kinds of other infections that you had been immune to prior to the infection with measles. This is a real phenomenon that occurs if you get infected with measles. This graph shows the effect of the attenuated vaccine for measles portion of the MMR vaccine and the reduction in cases. Notice, however, that instead of talking about handfuls of cases, we still see hundreds of cases with periodic outbreaks that occur, primarily because of the breakdown of herd immunity in people that refuse to be vaccinated with MMR. We see that these clusters of cases that usually occur in communities where there's a high number of individuals that are not vaccinated against measles. In this last section, we're going to talk about some of the more unusual infections of the skin, the mycoses. These are infections caused by fungi. Most of these are opportunistic. They don't cause problems in normal, healthy individuals, but if you have a decreased immune system, then they can turn problematic. These fungal infections, called mycoses, are broken down into superficial infections, which are just on the top layer of skin, the subcutaneous, which go a little deeper, and then systemic, but we'll not be talking much about systemic in this chapter. The superficial mycoses are shown on this slide. Piedra is just an infection of the hair shaft. You can see here the fungal nodules on the hair shaft. So nothing more than a cosmetic issue. However, it can be very difficult to get rid of. You might have to cut your hair very short in order to get rid of it. It tends to occur in tropical areas where there's a lot of moisture and humidity in the air. Psoriasis versicolor happens on the top layers of skin. Again, a superficial infection on the top layers of skin. It's cosmetic in nature and not dangerous. You'll see that these discolored patches on the skin, it can take the appearance of hypopigmented or very light patches in the skin, or it can be hyperpigmented, darker patches on the skin. You can get rid of these lesions with topical antifungals or even something that's over the counter. 1% selenium sulfide will get rid of it. This is what you can find in dandruff shampoos like Selsun Blue or generic versions of that. But look for the ones that actually have selenium sulfide in it. The other types of dandruff shampoo don't work. Soap it up, leave it on for a few minutes, and wash it off. You do that for a while and the infection will resolve. The disadvantage of this treatment is that the skin may take on a peculiar odor associated with the selenium sulfide. It smells a bit medicated in nature and some people do not like the smell. Hopefully the treatment does not have to continue for too long, but sometimes the condition does return. Going a bit deeper, we look at the fungi that grow in the deeper skin layers. You can see an image of what's commonly known as ringworm here and athlete's foot here. These are deeper fungal infections that again can be treated most often with topical types of antifungals. They're infections that you can spread from person to person with close contact or with contact with fomites, as in the case of something like athlete's foot. The cell-mediated response to these fungal invaders are what leads to some of the damage to the tissue and inflammation. This table from your chapter goes through some of those fungal infections. You'll notice that the infection location is what the name of the disease is after. Tinea pedis, athlete's foot, but it could be caused by the same organism that causes jock itch or ringworm, which is Tinea corporis. So it's named for the spot on skin that you find in the fungal infection, but the agents can actually be the same. You don't have to memorize any of these fungal agents, but be familiar with the common name and the condition, such as athlete's foot or jock itch or ringworm. We also have fungal infections that can be introduced by a wound. Sporotrichosis is shown right here, and this is caused by a fungus that's what's called dimorphic, meaning that it'll be a mold with it when it's in the environment, but once it's introduced into your body, it becomes a yeast and it spreads as a yeast. Usually, this is traveling along a lymph vessel, given the name rose gardener's disease because it's usually a puncture wound like a thorn that introduces the organism and then it starts to multiply. You can see here that it's traveling right along a lymph vessel up the arm of this individual. We have two more conditions to talk about. Leishmaniasis is a protozoal disease that's caused by Leishmania, which is a genus. It's transmitted by a biological vector, in this case the bite of a sandfly. What you'll find is that the parasite gets introduced by the fly and it's picked up by macrophages but not killed by them. The macrophage will end up traveling around and spreading the organism through the system. It can start out and stay cutaneous for quite some time, resulting in large, painless skin lesions. The individual here is at least suffering from mucocutaneous, where the enlarged lesions involve the mucous membranes. Visceral infection means the organism has spread through the system, and visceral infections are the most dangerous. It's endemic in the tropics and the subtropics. Some of our troops came back from areas of Afghanistan with this infection. You have to diagnose it by finding the organism in the scrapings of the wound and identifying it that way. It's more difficult to treat. There are not a lot of good drugs against protozoa, but there are some treatments that are used. The last infection of the skin to be mentioned is scabies. Scabies is really not a microorganism per se because it's really a small mite that's causing the infection. You can see it here. It's usually transmitted by prolonged bodily contact with people in unhygienic conditions. You have to use mite-killing lotions in order to get rid of it. And the only way to prevent it is really good personal hygiene and avoiding contact with infected individuals. The inflammatory response leads to all the itching and uncomfortableness. Therefore, you may only have a few mites on the individual, like perhaps 10, so you might miss them when you're looking for them, but it can cause a large-scale, very intense itchy rash at the site of infection. The immune response is directed very strongly against the fecal matter of the mites as well as the eggs that they lay. So, this concludes our discussion on skin infections. It's not quite comprehensive by any means, but these are some of the skin conditions that you can acquire and the different organisms that cause them. Now would be a good time to construct a study table, breaking down the disease or conditions, the infectious agent and what type of organism it is, how it's spread, the key signs and symptoms, as well if they're a treatment or not. See you in the next chapter.